ways in which health centers are providing behavioral health services, and I anticipate that within the coming months we'll be learning from that survey a much greater sense of the profile of behavioral health service delivery in health centers, and I look forward to seeing the results of that survey. Briefly, health centers today, about a third of them are providing substance abuse services and counseling on site, and about two-thirds are providing mental health services directly. In general, they are serving almost 760,000 patients for behavioral health care needs. And screening and brief intervention referral to treatment expert is a service that we're seeing more and more in the health center community. They have a substantial workforce unto themselves providing behavioral health services. There are over 1,100 health centers across the nation, and they include 3,400 behavioral health providers across those 1,100 health centers. Obviously, some health centers with a larger behavioral health workforce, some with a smaller workforce, but they would include psychiatrists, psychologists, social workers, substance abuse providers, and other licensed behavioral health providers. The Affordable Care Act has provided a significant increase in funding so that we can assure that we have health centers in the most underserved communities across the nation. We're seeing opportunities for new health centers as well as expansion of existing health centers, and importantly, expansion of behavioral health services within existing health centers. In 2011, we've already seen a request for proposals for the new health centers, new starts or new access points, as well as recently the request for existing health centers that would like to enhance their provision of behavioral health services. So just to sum up on the health center program, I think it's the type of provider that will be an important source of a healthcare home. What I like to say is that in general, health centers are a preferred site for a health home for behavioral health service delivery when appropriate, when the workforce is there, and when it is not necessarily as comprehensive as one would like to have effective referral relationships with the behavioral health providers in the community. What will HRSA be doing in the future to promote behavioral health care? I just want to talk about that briefly before we move on. I think some of the areas that we'd like to, engage in further include medically assisted treatments in both the health centers and in the HIV and AIDS